Do you have an estranged adult child that has a mental illness? Well, in this video, we're going to discuss how mental illness contributes to estrangement, and you're going to learn 7 keys to how to navigate this condition. Hi, I'm Marie Morin. I'm a therapist and a wellness coach. Let's get started. When an adult child suffers from mental illness and they're also estranged, it can be just so disturbing, so upsetting for the parent. But for the person that's struggling with the mental illness, for the adult child, it is horrible. It's really tough. Of course, the adult child is struggling. And they are having a really tough go at this, as you are as well. And they need compassion. And this is the best thing that you can give your adult child. But hold on to the end, because we're going to learn some really key things that will help you. So mental illness is not anything that anyone chooses to endure. And it affects functioning. It affects the way one thinks, the way that one perceives, and the way that one regulates their emotion. More than 50% of individuals will be diagnosed with a mental illness in their lifetime, and 1 in 5 will experience symptoms of a mental illness in a given year. Sadly, mental illness and everything around it still deals with enormous stigma. Stigma is a mark of disgrace associated with a particular circumstance, quality, or person. Stigma creates this difficulty around being able to get treatment, as well as being free to share, hey, I'm experiencing this. And it could be really upsetting for the person that's struggling with it. And the fact that someone won't get treatment really harms their progress and keeps them feeling terrible longer. Let's define mental disorder: any condition characterized by cognitive and emotional disturbances, abnormal behaviors, impaired functioning, or any combination of these. Such disorders cannot be accounted for solely by environmental circumstances and may involve psychological, genetic, chemical, social, and other factors. Now, when we talk about mental disorders or mental illnesses, we can include things like mild depression, severe depression, mood disorders, dissociative disorders, personality disorders, personality traits that don't actually fit into one disorder, substance abuse disorder. Each of these disorders has an effect on the individual, as well as their ability to function and the way that they relate to others. When a parent and adult-child relationship has mental illness in it, if the parent has the mental illness, sometimes the relationship is so strained and the parental behaviors are so unsafe that the adult child must leave the relationship in order to feel safe. Now, it could be that there is an adult child that has symptoms of a mental illness or a diagnosis, and the parent has symptoms and/or diagnoses, and the two together creates a lot of angst and a lot of stress in the relationship. When parents have mental illness, it's not uncommon for there to be behavioral instability. What does this mean? This means that a parent may be different from one day to the next. This is very unsettling for children, and it's very unsettling for parents. The parent's behavior may be so erratic that even as a child, the child disconnects and there becomes an alienation in the home, meaning the child is disconnected from being close to the parent or wanting to be there with the parent. And so you have this disconnected relationship early on. When there is severe mental illness, let's talk about bipolar disorder. So with bipolar disorder, there are mood swings, sometimes more severe, sometimes less. But in those severe times or mood swings, you can have someone that is extremely depressed or moderately depressed. And depression brings on this lack of being able to do anything, lack of motivation, lack of the ability to maybe get out of bed, go to the grocery store. When these things happen, it's an undue stress on the adult child. And the idea that there's this consistent level of instability. You always know that something is going to happen and it's going to be hard on the adult child. This is a stressor and can create a perfect storm for an adult child to say, I cannot manage this. I cannot be around the parent that has this mental illness. Now, from the perspective of the parent having a child with mental illness or an adult child with mental illness, naturally, there's a lot of worry. How is my kid going to be? What if I'm not talking to them? Are they going to be safe? Are they getting the help that they need? Do they know how to get the help? What if they're really in trouble? Are they going to reach out to me? And if they are really in trouble, am I going to know about it? All of these things can really put a lot of stress, angst, pain, worry, concern, anxiety on the parent. Parents generally have a really hard time with this because you don't know what to do. What do I do? First of all, there's laws that protect adult children from the parent interfering with the adult child's mental health care. And secondly, whether someone has mental illness or not, they want their parents to see them as an adult. Yes, but you might be saying to yourself, yes, but my adult child is not doing well. What should I do? I ought to be doing something. I need to be there to help them. And this is where parents usually get into a lot of trouble because there's boundaries that need to be created. And when these boundaries are not there, adult children tend to get upset about this. They don't want to be treated like children anymore, regardless of the fact that they have a mental illness. And so it becomes very, very difficult and strained. There's certain dynamics that complicate the estrangement piece even more. An adult child gets a diagnosis, they're not happy with their parents, there hasn't been a perfect fairy tale upbringing, and the adult child comes to realize, my goodness, my upbringing was a mess, my parents weren't consistent, there were a lot of problems, it was all their fault. And many of them may come to the conclusion that there was parental failure. Now, let's pause for a second, because when there's neglect, when there's abuse, when there's a toxic environment, we know that toxicity is consistent, okay? This is definitely the framework and the foundation of estrangement for an adult child, because there's no way that a grown adult child wants to be in a relationship with a parent when those things have gone on or they continually go on. However, not every parent is guilty of abuse, toxic behavior, and narcissism. And in these cases, adult children getting a diagnosis or having these symptoms can come to the conclusion that it's all the parents' fault, especially if there's mental illness that runs in the family and there's something that has gone on, such as alcoholism or bipolar disorder or depression, or there's been suicides in the family. So the adult child can come to the conclusion that, well, you know what? My parents knew about this and they didn't get me the help that I needed when I needed it. Okay. That's one scenario. When an adult child has been traumatized by an outside party, not having anything to do with their parent, it was someone else, okay? The adult child can grow up and say, you know what? You didn't protect me. You didn't make sure that I was okay. Now, there are parents that don't protect their children, but not every parent is guilty of not protecting their child. And so with this diagnosis and with this accusation and blame on the parent, it could be really complicated for the parent and the adult child to navigate this situation. So as you can see, the complications and all of these elements that can participate and contribute to factors that would help someone feel unsafe, okay? The adult child feeling unsafe and saying, I really don't want to have a relationship with you. It's so complicated. What happens for parents is that the worry about their adult child, no matter what the circumstances, can create this idea of hovering. Or, we talk about for small children of a helicopter parent, and the parent can become this sort of like nuisance to the adult child because they're so worried. They constantly check in. Are you taking your meds? Did you go to the doctor? Are you seeing your therapist? This can create so much stress that the adult child could say, hey, I just can't do this anymore. I need to disconnect and leave this relationship. As you can see, the parent's behavior is unsafe to the adult child. Well, similarly, the adult child having a mental illness and their behaviors that are symptomatic of their illness can be equally unsafe for the parent. If their level of function is such that they can't keep a job, they can't keep an apartment, they may require and insist on help from the parent, being in and out of the home, demanding a lot, or not demanding and coming in extremely depressed, and the parent feeling like, what else could I do? I have to help my kid because there's no place else for them to go. This can be extremely stressful for all parties, and sometimes adult children can be so either demanding, needy, or manipulative, depending on what's happening to them. But not every adult child is like that. The stress on parents can be just unbearable. And yet, the burden for them is, if I'm not doing it, who else will? There could be a lot of fear imposed on the parents that their adult child is going to leave and not come back. And because they want to know what's going on with their kid, they put up with a lot of stuff. And so there's this tension of, my adult child is just behaving really badly because they could be really agitated, they could be demanding, or they could be really sick and refusing to get help. And so the burden on the parent is great, and they feel like they don't really know what to do. So what can parents do? There's this idea that we want to take care of our children, but there's really no best way to accommodate them. They want our help, but they don't want our help. Maybe they want financial assistance, but they definitely don't want parents telling them, did you go get your meds? Are you taking your meds? What happens often is that there's a clear lack of boundaries, no boundaries. When there are no boundaries present, it really is difficult to have any stability. And adults, whether you're parents or adult children, life is a lot less stressful if there is a degree of stability. Boundaries give a fence around you. They place a fence around you and say, this is what I will take and this is what I won't take. And making those clear will really help you. The first key is to decide to create a boundary that states that your well-being and safety matter. The second one is to be informed about your adult child's mental health condition. So this is really important. You're going to want to know what they are experiencing, not because you're going to micromanage them, but because you want to empathize with what's going on for them. No one ever chooses to have a mental health diagnosis. No one. The third thing is to set a boundary of what you will and will not accept. For example, let's say that your adult child has a habit of screaming at you or erratic, angry behavior. You don't need to accept that because you're worried about your adult child's well-being. So this is setting a boundary of what you will and you will not accept. The fourth thing is to create a boundary of what you will accept from your adult child and how you will support them, but also keeps you from harm's way. For example, if your adult child is erratic in their behavior and they tend to yell at you, and this yelling causes you so much stress that it's making you sick, you're in harm's way. So creating a boundary that states, if you want to contact me, I would love to hear from you. However, you're going to need to text me. I'm not going to take your phone calls if you're going to yell at me. This is good for you. The fifth thing is to learn communication skills so you can say this in a way that it can be received. So what am I talking about here? So for example, you're upset about something, your adult child is upset about something. If you're all emotionally charged, you're not going to respond in a way that's going to be calm. You're going to try and say a boundary that's going to blurt out something inappropriately. So learning how to communicate, learning how to do it without being emotionally charged is really key to keeping this relationship in the framework of a boundary and making sure that you're safe. The sixth thing is to stick to your boundaries by getting support. It's easier to stick to your boundaries if you have people in your corner. You can get a therapist, you can get a coach, you can go to NAMI meetings, you can go to a codependency group. The idea is that you don't do it alone. You need to get support. And the seventh key is to inform your adult child that you love them, that you hear them, and that you validate them. This is really difficult because you don't want to be in a situation where you're being triggered, where you're being stressed out because your adult child is behaving in a certain way. However, you also don't want to put yourself in harm's way. You won't be able to be the parent that you want to be if you're so stressed out. Some of you may be saying, well, I listened to this whole video and guess what? I don't even get to talk to my adult child. They have a mental illness and they won't let me talk to them. I haven't heard from them in this much time and it's really upsetting me. And I will tell you that you still need to have boundaries that say that you care for yourself, that you are caring for yourself. Many parents who have estranged adult children with mental illness run themselves ragged in their minds with worry because they don't know what's going on with their adult child. So many of these keys are important for you. Boundaries within yourself that say, hey, I matter. And when you matter, you take care of yourself. You still learn how to properly say things. You learn communication skills. You learn how to put yourself first so that you're caring for your well-being. You're learning how to calm yourself. And you're also being informed. You're getting support, okay? So I hope this video has been a help to you. Please leave me a comment and tell me what I missed. What is it you want to know about when it comes to estranged adult children and mental illness? And if you like this video, hit the like, subscribe, and ring the bell. And please get my ebook. It has so many excellent tools and tips in there to help you through this estrangement time. We'll see you in the next video.